Why did I become a neurosurgeon? In addition to a love of neuroscience and a desire to serve, the mentors in my life modeled for me a life of purpose and meaningful impact. I was sold.
No, that's an easy question, I think, for any of us to answer. I think most of us, the answer would have been, there wasn't anything else that's good to do as this. But neurosurgery is extraordinarily special. I mean, I had an uncle who was a neurosurgeon, but my father was a pediatrician, and uncle was a gastroenterologist. But yet, there was something about my uncle as a neurosurgeon that was pretty special. Neurosurgery is very rewarding, and intellectually so challenging, you know, so beautiful to understand the nervous system and the brain and how it works, and to know the effect that you could have and the responsibility that you have, the trust that patients place in your hands. So I wouldn't choose anything else if I have 1,000 times to choose.
My path to neurosurgery actually began on the stage. I was a professional dancer, mainly contemporary, modern, and ballet, before becoming a doctor. When you think about it, surgery, like dance, is a series of choreographed movements done technically well, over and over. It also has to be creative at times, and it's usually done by people that enjoy performing and excel when they're under pressure. I found all of this and more in becoming a neurosurgeon.
The first week of medical school, I was fortunate enough to go to dinner with two neurosurgeons, Len Cerullo and Tom Brown. So I was initially drawn to the people of neurosurgery. The same week I went to the operating room with them and fell in love with what they did. And then finally I went to clinic with them and fell in love with the patients and what they could do for their patients. In short, there's nothing else I'd rather do. I'm so glad I did it. I'd do it again in a heartbeat.
I became a neurosurgeon because I was fascinated with the brain and the workings of the mind. In 5th grade, I used my parents' old medical school books to do a class presentation about brain tumors. And that began my journey to becoming a neurosurgeon. As a medical student, I realized that I loved operating. And I loved the hard work of solving some of the most complex surgical problems. I'm humbled by the awesome responsibility that comes with taking care of neurosurgical patients and helping the patients and families get through some of the most difficult times. Ultimately, I became a neurosurgeon because it was fulfilling and it was fun. And as I look back, I can honestly say that I would never have chosen anything else.
So why did I become a neurosurgeon? Becoming a physician felt like a calling, but becoming a neurosurgeon was a choice that I made as a medical student that I think I can best distill into 2 words: inspiration and aspiration. You know, as a student, I was already fascinated with the complexity of the nervous system and the intricacies of neuroanatomy. But I was ultimately just incredibly inspired by the neurosurgeons I encountered, who were by far the most focused, knowledgeable, and hardworking physicians I had ever met, with a real passion for their clinical work, for teaching, and for research, and a real compassion for their patients, for whom they were making a real difference. Once I saw that, I was sold. I could do nothing but aspire to emulate that and become a neurosurgeon with the opportunity to contribute to the field.
Hi, my name is Mike Wang, and I'm honored to be a neurosurgeon. When I heard about this, I wanted to get my message out and tell you that I think every day we do amazing things. When I was in medical school at Stanford University, I was going to be a dermatologist. But then I happened upon mentors, including Stephen Chang, Gary Steinberg, John Adler, Larry Scher, and they convinced me about what an amazing field this is. Every day we get to change lives, and the effects are absolutely dramatic. So thank you to my mentors, thank you to my current mentors. If I wasn't doing neurosurgery, I'm not sure I'd be a doctor.
I'm Ralph DACEY. I decided to become a neurosurgeon because when I looked over all the other specialties in medicine, I determined that were I to become a neurosurgeon, I would be stimulated and challenged for my entire career, that I would be working with the best people in the world, and that I would have the potential to have a big impact on the lives of the patients that I would come to treat.
Well, it's because I love neuroanatomy. I really much enjoy seeing the blind brain, the spinal cord, and the peripheral nerve tissues. I love technology. I know that neurosurgery is an infinite field. We've done huge scientific developments here in these last few decades, and that's going to continue because of the frontier of neurosurgery as it exists. And I really enjoy teaching neurosurgeon residents.
I became fascinated with neuroscience as an undergraduate. That fascination led me to the MD-PhD program at the University of Pittsburgh. While I was in the laboratory, all of my clinical mentors were pediatric neurologists, and I assumed that I would continue in that vein. I completed an early rotation in pediatric neurology as a third-year medical student and knew immediately that I was temperamentally unsuited to continue in that profession. I was casting about for what to do next, and I signed up for a 2-week rotation in neurosurgery. This was an epiphany for me. I knew immediately that this was my future. I consider neurosurgery a calling, not a profession. I believe that it's a privilege to serve the patient populations we serve, to train the next generation of neurosurgeons, and to push forward the frontiers of clinical neuroscience.
Hi, everyone. My name is TUMIALAN from Phoenix, Arizona. And I can tell you that I became a neurosurgeon because it is the one discipline where, as I was going through my various rotations as an intern, where form and function truly met. There's a true intersection between the neuroanatomical pathways and the areas of compression and disease that we found. And I can tell you now that 15 years into my career, 20 years after making that decision to leave one discipline, specifically orthopedics, and go into neurosurgery, it has been a very fulfilling career path for me. And I could not imagine it any other way. Whether it's taking care of something as straightforward as a lumbar radiculopathy or lumbar stenosis, or something as severe as metastatic disease to the spine, where you're walking with someone through a very difficult part of their life. Neurosurgery, where form and function meet, and the environment that we've created to advance the field has been nothing short of a remarkable career path for me. And I'm so happy that I was guided by mentors to take that path.
I wanted to be a surgeon since about middle school. I became a neurosurgeon because it was intellectually stimulating, because all of the questions in neurosurgery were not already answered, and because what we do in brain surgery, spinal cord, and peripheral nerve surgery affect the entire body. I do something different in the operating room every day, and it's so much fun. Being able to help patients in this way is just incredibly rewarding.
Hi, Reg. You asked the question of why I became a neurosurgeon. I do not know the answer, but I knew that I wanted to be a neurosurgeon early in life, and in my high school freshman yearbook, the question of what I wanted to be, my answer was to be a neurosurgeon. I consider medicine the noblest of professions, and neurosurgery among the most challenging and most rewarding, and it has been a privilege for me to be able to follow my dream. Thank you for asking.
I got into neurosurgery because of a TV show, a TV drama series called Ben Casey, which aired on ABC in the late 60s. Ben Casey was a neurosurgical resident at San Francisco General, and having watched so many episodes, well, it wasn't surprising that he bowled me over and I became a neurosurgical resident later on in life. I hope that helps. Thank you.
Why did I choose to be a neurosurgeon? I grew up in a family of physicians. My father's a cardiologist, my mom was an OBGYN. They encouraged me to go into their fields, but as a medical student, I didn't like either of those fields. I rotated through many services and did not find my calling until I happened upon a clinical elective in neurosurgery as a third-year medical student. As soon as I rotated, I had wonderful mentors who showed me the intricacies of the brain and the spine, and I was hooked. My mentors made a big impression on me. At BU, where I was a medical student. Ed Spatz was very kind to me. During my sub-I, subsequently at USC, Marty Weiss was very kind to me. And then subsequently during my residency, I learned a tremendous amount from my mentor, Mitch Berger, and subsequently from my mentor during my fellowship, Reg Hade. I knew I'd made the right choice. These mentors encouraged me to see the challenges that our patients face in neurosurgery and how to meet those challenges and to excel surgically and in clinical care and in research. And I think I've made the right choice now, looking back over the last 20 years of my career.
Hi, I'm Marjorie Wang. My first introduction to neurosurgery was by chance when I was assigned a 2-week rotation as a third-year medical student. After that, there was no looking back. What I enjoy most about being a neurosurgeon is I'm able to work on the most interesting part of the human body and to combine the art and science of clinical knowledge and technical skills to help patients overcome disease and have a better quality of life.
With the brain being the most complex and mysterious structure in the universe, I always knew that that was going to be my focus. But when I saw the live beauty of the brain for the first time in the operating room of Dr. Stephen Giannotta during one of his aneurysm clippings, I was completely hooked. And my appreciation for the intensity of the field has only grown since. To me, in the realm of neurological diseases, the buck will always stop with the neurosurgeon.